Knee arthroscopy. Knee arthroscopy is a minimally invasive surgical procedure used to diagnose and treat various problems inside the knee joint. During the procedure, the surgeon uses a special instrument called an arthroscope, which is a thin tube equipped with a small camera and light source that allows the inside of the knee to be viewed clearly. Knee arthroscopy is considered a safe procedure, and most patients are able to return home on the same day of surgery. Anatomy of the knee. The knee is one of the largest and most complicated joints in the human body. It is formed where the lower end of the femur, or thigh bone, meets the upper end of the tibia, also known as the shin bone. Another small bone, called the patella, or kneecap, sits within a groove at the front of the femur. The fibula, which is one of the bones of the lower leg, also connects near the knee joint. The ends of the bones inside the joint are covered with smooth articular cartilage, which helps the knee move easily and without pain. Between the femur and tibia are two crescent-shaped structures called menisci. These cartilaginous cushions absorb shock, distribute body weight, and improve the stability of the knee. Several strong ligaments hold the bones together and stabilize the joint, including the cruciate and collateral ligaments. Muscles surrounding the knee are attached to the bones through tendons, helping the knee move properly. The entire joint is enclosed within a capsule lined by a synovial membrane, which produces lubricating synovial fluid. Reasons for knee arthroscopy. The knee joint can be affected by many injuries and conditions. Knee arthroscopy may be recommended to diagnose or treat problems such as meniscal tears, injuries to the cruciate ligaments, damaged or torn articular cartilage, inflamed synovial lining of the joint, patellar malalignment, Baker's cysts, which are fluid-filled swellings behind the knee caused by excess synovial fluid, certain fractures involving the knee joint. Surgical procedure.
Knee arthroscopy may be performed under local, spinal, or general anesthesia, depending on the patient's condition, age, and overall health. The anesthesiologist will determine the most suitable type of anesthesia. The surgeon begins by making 2 or 3 very small incisions around the knee. A sterile saline solution is then introduced into the joint to expand the space inside the knee, providing a clearer view of the structures and more room for surgical instruments. An arthroscope, containing a miniature camera, is inserted through one of the incisions. The camera sends images to a video monitor in the operating room, allowing the surgeon to examine the inside of the knee in detail. After identifying the cause of the problem, specialized instruments, such as shavers, scissors, or laser devices, are inserted through additional small incisions to perform the required treatment. Depending on the condition being treated, the surgeon may perform one or more of the following procedures: repairing or removing a torn meniscus, reconstructing or repairing damaged cruciate ligaments, removing loose cartilage fragments, removing loose bone pieces, removing inflamed synovial tissue, removing a Baker's cyst, correcting kneecap alignment, performing microfracture techniques to stimulate new cartilage growth. After completing the repair, the surgeon carefully checks the joint for bleeding or other issues. The saline fluid is drained from the knee, and the small incisions are closed with sutures or adhesive strips. Finally, a sterile dressing is applied. Recovery after surgery. Most patients are discharged from the hospital on the same day as the procedure. Recovery time varies depending on the type of treatment performed inside the knee. Minor procedures usually heal quickly, while more complex repairs may require a longer rehabilitation period. Compared to traditional open knee surgery, recovery after arthroscopy is generally faster and less painful. Pain medication may be prescribed to control discomfort. Some patients may need crutches or a knee brace temporarily after surgery. A physical therapy and rehabilitation program is often recommended to restore knee movement, improve flexibility, and strengthen the muscles surrounding the knee joint. Risks and complications. Knee arthroscopy is considered a safe and effective procedure, and serious complications are uncommon. However, as with any surgery, certain risks may occur, including bleeding inside the knee joint, infection, knee stiffness, blood clots, persistent knee pain, or ongoing knee problems. Conclusion. Knee arthroscopy is an advanced and highly effective technique for diagnosing and treating a wide range of knee disorders. Because it uses small incisions and minimally invasive techniques, patients usually experience less pain, faster recovery, and quicker return to normal activities compared to open surgery.